So the messages I'm trying to convey during my lecture is first to get a firm understanding on where is this technique coming from. That's been almost 30 years of research, and also say what is relevant to consider today, but also look into the future and see what could happen around the corner. And I think we have some amazing improvements to expect during the coming 20 years.
The media would have us believe that amputees are an incredibly high-functioning bunch, and you can be a Blade Runner too if you're an amputee. And actually, the fact of the matter is, it is a very, very disabling thing. And the majority of patients aren't able to walk a mile on the trot. So it is very disabling. People struggle with stairs, people struggle with walking, people struggle being on their feet all day. Message one is, amputation is disabling. Message two is, there is a new kid on the block in the form of osseointegration, and potentially there are a small group of those patients who are particularly disabled for one reason or another, and they would potentially benefit from this new technology.
I think the take-home message is that we cannot at present produce a robust soft tissue seal at the implant skin interface akin to the gum in the tooth. This is not clinically achievable at present, so we have to accept a chronic wound, but we need to accept a manageable chronic wound, and I think the best approach to this is that which is advocated by Professor Brannemark and detailed in my talk, where we produce a thin dermal flap that then abuts the bony periosteum at the distal interface to produce minimal shear and minimal movement at this level.
The key takeaways are just the benefits to some patients who really would not be able to function well with what we call conventional prostheses. So it's those patients who are, such as one of our speakers today, who was basically using crutches for 5 years and seeing the dramatic change in her quality of life following osseointegration, which has been exceptional. And that's really what it's all about, is selecting the correct patients and good assessment.
Yeah, I guess it's treating the prosthesis as a complete system, and how we would make clinical decisions about the patient's care and choose componentry to best preserve the life of the implant and the abutment of an osseointegration patient, whilst also optimising their gait pattern and function.
Well, I think one of the outcomes of today's meeting was recognition that these patients are often quite complex, and the different specialisms that are managing these patients actually are not able to give a balanced opinion in isolation. And so these patients need to be assessed correctly in a MDT, a multidisciplinary team approach, at a specialised osseointegration clinic. And so we're delighted at LIPS to be able to offer this service in central London at the London Clinic. We're launching our monthly osseointegration clinic, which should be the ideal platform for these patients to be assessed.